to the 10,000 people who either dipped in or stayed with us all the way through last night's session. We had lots of questions on a range of subjects as we spoke to 4 ministers, including the Chief Minister. Tonight, a new set of ministers alongside the Chief Minister. I will tell you who. There they are for a little sneak peek in just a moment. First of all, let's set the scene as to why we're actually talking about all of this in the first place.
While the pandemic has created some unforeseen costs, I want to make it clear that in the Government Plan 2021 to 2024, we will also continue to invest in our future, and particularly in our future healthcare and education. We are going to embark on an ambitious 3-year reform programme for our education system. This will drive long-term, sustainable improvement in the educational outcomes of all children and young people. We also appreciate that children and young people were particularly impacted by the pandemic. To address this, we are introducing the COVID-19 Schools Catch-Up Programme to ensure that the loss of schooling for children and young people is addressed. We also are continuing to invest in the redesign of children and adolescent mental health services, known as CAMS, to support those experiencing mental ill health. On the healthcare front, we will implement the New Jersey Care Model, which will support the move to a more preventative-focused and community-based health service. Finally, the delivery of a new hospital for the island remains a key priority to ensure islanders have access to a world-class healthcare facility.
So there you are, education, housing, healthcare, and a lot more besides, and that is why this stuff matters. And I probably should not have a favourite night of the week, and I certainly shouldn't declare it in front of the ministers in case those not here tonight feel snubbed. But tonight, where we're focusing on investing in our future, feels like one we can all really engage with because of the ministers we have with us tonight. We have the Chief Minister, and that is Senator John Fondre. Senator Fondre, good evening to you again.
Good evening.
Welcome back after a busy day in the States. How was it?
It's been a long day, but I think Richard's had a good success. So we have the gatherings law in place and we have the masks law.
Excellent.
So now what we can then do is now bring some enforcement in, which is all again about trying to protect islanders and keeping to navigate our way through COVID.
We will perhaps get into some of that during the course of this evening as well. We have the newest minister on the block, the Minister for Children and Housing. That is Deputy Jeremy Maçon. Good evening to you.
Good evening, Gary.
How's it going 1 week in? You're still not regretting taking the gig?
No, but it's definitely been a learning cliff. There's been a lot of briefings going on, so I've had 3 legal arch files like this, so it's been a lot to learn, but I am enjoying it.
Can I just clarify, you said learning cliff, or did you actually mean learning curve? Because they're very different things.
Definitely, Cliff. It's definitely been very interesting to,
that is interesting.
to get that level of detail, which perhaps I didn't have before.
Excellent stuff. Right, it is the new ring binder man. Don't go knocking any votes in the States Assembly with your ring binders. We have the Health Minister, who is Deputy Richard Renouf. Good evening to you.
Good evening, Gary.
Just briefly following up from what the Chief Minister said there, for people who haven't been following the States debate today, today in essence was the Parliament agreeing to give you the power to create new rules around mandatory mask wearing, around the sizes of gatherings. Rather than it being a bit sort of namby-pamby, please do this, you can now put your foot down with a firm hand, if we like to mix our metaphors. When are you going to do that?
Yeah, indeed. As soon as possible, Gary. The officers are working on the orders that need to be made. But the important thing is that where we can see that the spread of COVID is a risk and people are not complying with what has been guidance so far, there will be powers to enforce what is needed.
So just to be really clear, are you about to bring forward an order to make masks mandatory, for example, from next week?
I am hoping, but there's still work to do, but I'm hoping that from next week, masks will be mandatory in supermarkets, shops, banks, pharmacies, that sort of.
Okay, we will keep an eye out for more details of that in the coming days, I'm sure. It was just to get an idea of how quickly you intend to use these powers. And we have the Education Minister, and that is Senator Tracey Vallois, who is joining us from Mission Control somewhere in Education HQ. Good evening, Senator.
I can't hear you.
Hopefully, Senator Vallois will be able to hear me at some point soon. But in the meantime, she is definitely there, and we will make sure we attach a cup and a string so we can talk to each other during the course of the next hour and a half. And tonight is about putting your questions to the ministers, so we can cover housing, we can cover children and young people, we can cover health, we can cover education. That's why I'm saying tonight really does feel like a hot topic night. You can do this by using something called Slido. It's an app, but if you just go online and Google Slido, S-L-I-D-O, it brings up a website. You enter the hashtag GovPlan2021. There you can see it. There you can see the hashtag, and there you can get a little preview of some of the questions that are coming in already. I will get through as many of those as I can during the course of the night. You can also email govplan2021@gov.je. And if you want to join us in a small COVID-safe audience, and we are creeping that audience in through the week, we've gone for a whole person joining us in the audience tonight. Maybe we'll have 2 or 3 or 4. If you want to do that, get in touch via the email address as well, because we're doing this every night this week. Right, I'm going to go through our ministers. And Deputy Maçon, I'll start with you first, as I say, the newest minister, but also getting your head around this dual portfolio of children and housing, 2 huge issues of our time. This government plan is what the government says it is going to do over the next 4 years. Could you, for people who've not read this, set out your stall as to what your domain, your area of responsibility, will actually do over the next 4 years if the plan is approved?
Yeah, absolutely. So the Children's Minister role obviously is responsible for the Children's Service, and some of the key developments that are planned to happen within that area. State's approval, of course, is needed. Is, for example, how we want to develop the CAM service. So that's Child and Adolescent Mental Health Service. So that's to provide more of an early intervention model, because sometimes things aren't picked up fast enough, and therefore it slides into more acute services. So the idea is to redesign the service so that more early help can be offered, and therefore we hope that obviously will be a better service to the public. Other things that are happening within that portfolio are also looking at the work we do with family nursing and home care, the antenatal service, and how we're reprofiling the Baby Steps programme. So we've had a really good relationship with family nursing and home care, rolling out the Baby Steps programme. They've had to deliver that in a slightly different way because of the COVID process, but that reaction has been really, really well. And another aspect, and whilst we've already launched the Care Leavers offer, what we're also planning on doing is how can we refine that, how can we improve that, so that children that are in our care or leave our care, have those types of things that parents would support their children with. So it's looking about how we can better develop that programme. So that's kind of in the children's section. In the housing section, the key one of the key aspects is looking to tackle the issue around the Housing Advisory Service. So we know, for example, the Citizens Advice Bureau gets around 2,000 queries every year about housing-related matters. So we want to take on that service and provide more directions and link people up going forward on housing issues, which we think will be a key thing. It will also help reduce the workload of the minister, I should just add. And the other points within housing, of course, is the homelessness strategy. So, for example, there's a greater grant going to the Shelter Trust in order to help support them with the homelessness strategy. And as we've seen from the annual report from Andium, what we also want to do is put officers in post to provide that strategic coordination between arm's length bodies and Andium in order to get the progress line on housing, much smoother, much more coordinated, and deliver more units.
When I read the government plan and I look at the area around children, and one of the government's stated aims is putting children first, and around housing, which falls under we will reduce income inequality and improve the standard of living, the headlines in the government plan are wet. It's awfully vague headlines. So these are the headlines. This is the government saying this is the best we can shout about in the government plan. We'll continue to implement the Children's Change Programme. We'll continue to focus on praxis improvement within children's services. We'll continue to progress policy legislation. We'll continue to provide redress to people who as children suffered abuse. We'll review future delivery of student finance. I mean, it all sounds like, yeah, we're doing all right, and our ambition is to carry on doing all right. Is that a fair assessment, or has your own government plan undersold the government plan?
Well, and again, this is like in the devil of the detail, because as you know, it's quite a lengthy document. So if you went into the detail to absolutely everything, it would be an even larger document. So let's just take for one example. So for example, progressing things about the United Nations rights of the child. So actually, there are some very key, big, meaty work streams within that workload, which of course need to come to the Assembly. They need to be considered. So for example, one thing is looking at things around youth and criminal justice, which of course is a link between myself and the Home Affairs Minister. Now, okay, it's implementing the United Nations rights of the child, but actually it's a huge work stream underneath that.
Let's talk about CAMS. You mentioned CAMS and about the importance of early intervention, and we've seen through various studies this year, whether through the Children's Commissioner or indeed through Children, I can't remember the whole name of the department, sorry, CYABCD, Education, SITE, that, you've done your own studies as well, levels of anxiety, concern, worry, and actually it's bleeding obvious. I'd be more shocked if that wasn't the case, because this has been an extraordinary year. I then look at the budgeting for CAMS next year as Children's Minister. Not a single extra penny is being given for 2021. I mean, there's a zero. It jumps out as you read the government plan. How do you square that circle?
Now, Gary, you're very naughty, because I know you asked this question last night, and the response that the Chief Minister gave you was, there is investment, but it's from what was left over from last year. So the CAMS service will be receiving investment. It's just not new monies in 2021. But what is important is that in 2022, there is about 1.75 million going into the CAMS service. So if anyone is concerned about just looking at the budget line under CAMS for this year, it's not the whole picture. And actually, there is investment and there is work going into CAMS, because it is such a huge priority.
It is. And I hear stories from friends, colleagues and acquaintances talking about their children and some of the issues they faced and some of the issues that have not satisfactorily been dealt with inside school and education. And then the signposting happens to CAMS, and there's a bunch of great people working their backsides off there, but there is just not the capacity to deliver timely, necessary, urgent responses. What difference, you and I sit down in a year from now, what difference do we expect?
So, as I said in my opening, we know that is part of the problem, and that's why we need to redefine the service so that we can capture. So it's the old analogy. You've got a cliff. Where do you put the net? Do you put the net at the top of the hill, at the top of the cliff, or at the bottom of the cliff? We want to move it to a situation whereby we catch people before they fall off the cliff, so that they then don't escalate into further more acute services, which are more difficult to support. So that's the plan, and that's why we're doing it in that way.
And just briefly on housing, and I've got lots of questions coming, so we will get to questions once I've done a round robin with our ministers. You spoke about some of the things that are in that plan. Just in terms of brass tacks, the affordable housing shortage in this island, the quality, particularly of rental accommodation, and we see an attempt to improve those standards with the Landlords Register being chucked out for various interested party reasons, including some people around this panel tonight. What actually happens in the next 12 months?
So again, I think for those particular, the thing is, the housing minister builds housing units through our partner agencies, SOJDC and DIAM. The planning minister finds sites that we can then build to deliver, and often there is a marriage between what the planning minister does and what the housing minister does. So of course, in my role, I obviously need to work very closely with Deputy Young, the Environment Minister, in order, for example, in his New Island plan, to identify sites, to look at the planning rules, to perhaps ease some restrictions in order to develop the units, as well as looking at things like minimum housing standards. And of course, I've been on the planning panel for about 12 years, so I do know one or two things which I'll add into the conversation.
And have you got the mettle and will to do that?
To have a conversation with the Deputy Young, absolutely.
No, to actually get stuff done.
Absolutely.
Good.
Yeah.
Okay, good to hear it. Let's speak to the Health Minister now. So, just a small area of government. Not much been happening in the world of health this year, Deputy Renouf. So let's go through. The government plan covers an awful lot about COVID, about what's happened so far, about the cost of it. But if we can try and look forward and accept all of that, amazing work has been done from healthcare workers, voluntary groups, civil servants, politicians at various points as well. In this government plan 2021 to 2024, improving islanders' well-being and mental physical health is a priority. What are you doing? What will we see over the next 4 years, Minister?
Gary, what we will see is an increasing emphasis on prevention, on making sure that we stay healthy, rather than trying to address problems when people fall ill. That's recognised now throughout all Western economies, I think, that there are huge challenges in populations, because the good news story is that so many people are living longer into old age, but they're living with long-term conditions. We need to, and Jersey's no different, we need to help people manage those long-term conditions to stay as healthy as they can with the conditions they might have to live with, and as far as possible to try and prevent ill health before it becomes a problem. So that's the emphasis we want to start on for the next 4 years.
And this is something people might have heard called the Jersey Care Model, which is in effect I suppose it's an attitude as much as it's a document. It's an attitude, it's an outlook, which is, and again, I come back to bleeding obvious, prevention is better than cure.
Yes. It's all a key part of the Jersey Care Model. There's much else in the Jersey Care Model, but that's it. And we will be working with the voluntary sector, with our GPs, with everyone involved in health and social care to try and deliver that initiative.
Mental health is a big, ongoing and growing issue. I remember speaking to Rob Sainsbury, the MD at the hospital, I think it was the back end of 2017, where he said his big ambition by the end of next year was to have a mental health facility in place. And look, everything drags and every timescale drags. I think we know that as a political truth. When do you think we will have the mental health facilities that we don't just need, but that we perhaps deserve?
So there's the question of an acute facility, but there are also facilities for care in the community. And that's a vital part also. And we have begun to turn the corner on that. We've begun to provide the service that is provided by the Listening Lounge, which is a wonderful service. We've also made improvements in Jersey Talking Therapies. We've completely refurbished the outpatient facility now, which is ready to receive people receiving treatment in the community in good modern conditions that befit a proper health service. And then for our acute mental health ward, that's been so difficult to change, but we have made improvements there which have been recognised as the best we can be in those premises. But we have begun building new premises, and we will ultimately move to have our acute mental health service co-located with our general hospital at Overdale.
But that's a long time off. So what happens in the meantime? Do we just put up with, you said effectively the best we can shove in a rubbish building right now does not sound...
Absolutely not. No, we have that interim solution. So we are extending and refurbishing across the road at Clinic Pinel. That work has started and it will be finished in a year. These things take time, but we are creating there a superb centre which will serve us well until we can move to Overdale.
I look at the spending for health. It goes down every year. Other departments' budgets overall, yours, Minister for Health and Social Services, 237 million next year, then 232 million, nips up a bit to 234 million, and then by 2024, 227 million. Without even factoring basic inflation, if we factor in health inflation, which we know is of an entirely different sphere to normal life inflation, that seems perverse.
Yes, but I'm not sure if that is the new money that is coming through the government plan, Gary.
I'm looking at it. I'm reading from your government plan. Resources mapped to ministerial portfolios. Minister for Health and Social Services next year, 237 million. 2024, 227 million. You're having £10 million taken off you in 4 years from now.
So it's a complex plan because, for example, we need to deliver so many digital improvements within health. That is being delivered. There's money for that in the government plan. That money is held centrally because we need those digital improvements across government. But that money is going to be spent in health So you need a reading of the whole plan to understand where these improvements are being delivered.
And actually, that is a key point, isn't it? I wonder how COVID has helped, because I think a lot of people were quite reticent and nervous about data, electronic patient records. I've kind of got my head around it and got it for quite a while. For me, my health record should sit here. I should be able to press a button when I'm in front of the oncologist, when I'm going to phlebotomy, when I'm seeing my GP. It should happen by magic. The reality right now, the fastest way for me to get a blood test from Jersey to my consultant in Southampton, the fastest way is to walk into oncology, ask them to print out my blood test results, photograph it on my iPhone in the Notes app, attach it as a PDF, and email it to the consultant in Southampton, because the official channel is ridiculous. When can we fix that? That just sounds 19th century, and we are in 2020.
It does, Gary, and it has been that way, and it's needed to be changed. But
you have been minister for 2 years.
Yes, and you know, it was just a week or two ago that we announced that now GPs can order from their laptops in the surgery. They can order tests from the hospital, and the hospital can deliver the results of those tests online. It does away with paper. So all those results can come through, be stored on the computer, doesn't need to go into a paper file. Similarly, the ordering can be the same. So that is a step forward, a significant step forward, which I'm very pleased to have seen at last come about. And that in the government plan, we plan so much more for next year and subsequent years.
Right, let's go to our fourth minister tonight. Senator Tracey Vallois is there. I feel like Eurovision. Minister, can you hear me?
I can hear you, Gary.
Hallelujah. Right, the Education Minister is online. I'm delighted to hear it. Senator Tracey Vallois, education then. I hope you've heard what we've heard so far. I'm really trying to get a practical sense of what difference you are going to make to people's lives over the next 4 years, starting next year, if this plan is approved. What are you going to do?
Okay, Gary. So in the funding for next year for education in particular, one of the big pieces of work is the education reform programme. So we'll have an increase of roughly around £7.9 million. And why is that important? Well, one, we haven't changed our funding formula, which is really important to identify the particular demands and needs for our children and our young people in education. You've just spoken there about mental health. We're talking about prevention and putting in place the appropriate steps to ensure our children, young people going into the future will not end up on a higher level of that need in terms of their mental health. So we need to put in a really good structure, a 21st century structure that also absorbs the needs around technology and the recognition for facilities in the appropriate manner, so that our children and our teachers can thrive in those environments. So the stepping stone to that will be doing our funding formula, increasing our Jersey premium. We have further funding. Well, we have funding for the early years in there as well, and this will be working in conjunction, of course, with our health colleagues and also with our children's services and mental health services team.
What does that actually mean? I've heard this said a couple of times. I saw it a couple of weeks on the news a couple of weeks back when you were talking about this educational reform programme. I don't quite get it. I mean, what does that mean? Different types of exams? Does it mean changing the table layout in a classroom? I'm sorry for sounding thick. I genuinely don't quite understand what it means.
No, it's a huge project. That's why, Gary, it's not going to be a simple click of the fingers and it happens overnight. So the education reform programme will be a 3-year plan, and there are a number of steps in this, and there's a whole timeline behind this about putting in place support for children that aren't necessarily at the level they should be at entry of school. So that'll be an extra part of this. There's also the need to put in place an education white paper. So you would have seen the independent school funding review that was released. Now that whole document goes into detail, not just about the funding that we're looking for with regards to the government plan, but actually there are some policy options on there. So we'll be looking at the areas of those policy options. I mean, they are big and they are some difficult questions to ask and challenge our island around things like 14 plus, things like means testing in fee-paying schools, moving our mandatory school age from the age of 16 to 18. So that'll be part of the work. And what is really important with regards to the education reform is that our officers will not be doing this off the side of their desks. We'll have a dedicated implementation team to enable this to happen more swiftly, and working directly with those on the front line to make sure we get it right.
There's also £904,000 in the budget next year for the COVID-19 catch-up programme. We know teachers, teaching assistants, ancillary staff, parents, carers, people in the community, voluntary groups, after-school groups have all worked in a Herculean way this year to keep the show on the road, doing stuff they never imagined they'd be doing if we spoke to them at the start of March this year. Just paint a picture for me of how big that problem is, how much catch-up is needed, how much has been lost, because I hear two versions of the same story. One is that kids are amazingly resilient, and actually, do you know what, for some they've used this to thrive, to step up to the plate, and actually they've seen this as a challenge to grasp, whereas for other children it's been characterised by worry, by anxiety, by uncertainty, by horrific conditions going on behind closed doors in the familial home as well. Just paint a picture of what it's like in Jersey, because I suspect a lot of people don't know.
Okay, so of course everybody would have been affected by the COVID situation differently, and like you said quite rightly, some of our children, young people, are very resilient. Sometimes actually those that you think are more resilient are maybe not so much, but there have been issues around whether that's isolating in small apartments without enough space, or with the lockdown and not being in school. One of the big issues that came out of that survey with the students was that their concern not having that social interaction. They need that social interaction, and that's a really important part of being at school, with being with their friends, and so this has all affected them in a number of different ways, whether that's anxiety, whether it's mental health. With regards to their learning, maybe they didn't understand as well as they could do when they're in the classroom. So we've produced the report about learning at home, and recognised that some of the difficulties that these children have had. So we're putting in place a programme. So part of that would have started this term, and then the 904,000 for the government plan for next year will finish off the academic year for our schools with O'Leary teaching programme, which helps support the students, and making sure that we've got the appropriate technology and support in place.
And just briefly, let's just talk about fabric, talk about the buildings themselves. I know there's big ticket stuff, Montalabé, Vic College Prep, but actually when we go down the funding list to stuff that doesn't sit under major projects, it appears actually quite a number of schools will be getting some investment in this plan.
Yes, there are a number of schools. So there's the plan for Lalonde Nursery, which is the last nursery on our primary school list to look at. There's the plans for Victoria College Prep as well, that are under our capital programme. Of course, we get a certain amount of money for minor budget capital programme, and so there are a number of things that are being looked at in terms of the capital programme that will start straight away next year, including for our youth services as well. But there are other things whereby we're creating feasibility studies so that we can start that project soon after that.
Okay, we have got lots of questions coming in. Thank you so much for those. You can use Slido, just Google it, or use the Slido app, and the hashtag is GovPlan2021. There it is. You can see the questions. I promise you, in 2 minutes, I will crack on with those questions. I say 2 minutes, it might be 3. Blame the Chief Minister, because I'm coming to him next. Chief Minister, we don't need to go through the nuts and bolts of all of this. I know you were sort of waving to say something when the Health Minister was talking around funding around health, and actually how a lot of that is also central spending around technology. I think it's probably worth touching on a little bit of that. The digitalisation of government, and it does still feel like it's an analogue government, even though we're putting services online. I try and pay my freelance social security contributions online. You try making that web form work on a mobile phone, and even the address fields, it seems, is designed for somewhere in America because it's got 38 street names. I mean, it's ridiculous. This is basics. When are you going to sort it?
That's the point. I think let's go back to last year, and we actually received a degree of criticism from the amount we wanted to spend on IT. And I suspect that criticism may or may not continue, but certainly the analogy I've used it in scrutiny, I've used it, I think, at the IID as well. But if you go back to last year when we were starting to roll out Office 365, I freely admit I personally had never heard of Teams, which is the Microsoft app, which is the equivalent of Zoom and Skype and all the rest of it that we all use. And now you look at where we are and how things have suddenly changed. Now, if we hadn't actually started taking those measures last year, boy, I think we would be in a mess. And what that's allowed us to do, and people may not think it's a good thing, but it's allowed us to react accordingly. We've had the first virtual States Assembly. It's the first parliamentary assembly that's met in the Commonwealth fully as a result of that, and digitally, and being able to vote and debate and hold questions. So we have shifted so much, but that is why the infrastructure and the investment in IT in the past has not been sufficient. In principle, detail might be slightly wrong, but when I first started, I never realised that the fundamental financial accounting system, you mean, oh my God, that's boring stuff, but it basically controls all the budgets, all the bits and pieces that keep government together. It is basically as old as I've been in the States.
Absolutely.
And
I mean,
so,
I speak to some of the staff and some of the servers and some of the operating systems, and I know they are loath for it ever to get out what's being run on what where, because we should be ashamed of ourselves.
That's the problem.
But then I look at the tax office only last year buying in from a startup in New Zealand something off the shelf and then badly reverse engineering it to try and get it half-cocked working. And that was last year. So if you can't get a new project right, how can we trust you to sort this stuff out when it sounds like you don't know your backside from your elbow when it comes to technology?
Unfortunately, and I honestly haven't gone into the tax system very much.
Seriously, you really should.
No, what I was going to say
People are so annoyed by it.
Is I do know that it started before our time, if that makes sense. I mean, it was a good investment to make.
Why?
But
Why was buying technology that was not designed for use in Jersey good?
Well, hang on. What I was going to say is the old system was about 35 years old.
Yes, so make it 37 years old and buy the right kit.
You needed to have something that came into modern day standards. I know there were a lot of teething problems around it. It may have been also around a whole range of implementation issues that took place. Sometimes this happens. As I understand it, they are now in a far better place. So you have glitches. They have dealt with things like personnel, I believe. They've got it under control. You can now do your online filing. And I did hear some complimentary remarks, actually, from the tax profession about that side. It will always take, when you're changing a complex system, there will always be something goes wrong. But just to give an example around the digitalisation side, and this is actually around, if you think of the testing regime we've had in place, when it first started, as I've understood matters, each individual test was sent through as a PDF file.
It had to be hand transferred. It was
mental. And so then they actually took some guys from the modernisation digital side and Digital Jersey, and actually followed that process through to then speed it up and speed it up and speed up to what we've got now. And that is effectively what you're having to do on a whole range of really clunky systems that sometimes communicate to each other, but not brilliantly, and or are very old, and or are just on systems that almost don't exist anymore. So that's what people have had to come in and grapple with, and that's why we've got to spend the money we've got to, because actually then you do the investment. You get a service that is fit for the 21st century. As you say, many people these days expect to be able to see it on their mobile, or at the very least on their screen.
Yeah.
But also then, ultimately, we've said we've got an ageing workforce, we've got an ageing population. That does in itself, in a few years' time, start shifting what it costs to provide those services. But you've got to get the investment up front.
Yeah, but like you say, ultimately it creates efficiencies and productivity improves.
All
and
those
service
all
improves.
those things that you want to expect.
Okay, right. We will keep an eye on that. I was going to say,
I'm always slightly cautious claiming that on any IT system because I know there's always problems, but that is the ultimate ambition.
Okay, let's...
Gary, just before you could jump in, just to add to Richard's answer, just because I was there in health, it was my training section, just to add, we've also significant investment in the government plan in recruiting mental health nurses and senior nurses, which will deliver so many more sections. I just want to put that one in.
Okay, fair enough. Right, let's get to questions then. I am going in no particular order. How will the Education Minister address the lost learning time for A-level students who've been isolating as a precaution against potential COVID-19 contact, says Andrew. Of course, this is a story in the news this week where we have the entirety of the sixth form gone home because they might have brushed past in the corridor perhaps once at some point, even if they weren't in the same classroom. Minister, how are you addressing that potential lost learning, or indeed is the premise of the question right in the first place?
Thanks, Gary. Thanks for the question. So they should still continue to receive learning when they're isolating at home via the school, whether that's through the learning that was provided as per the lockdown, or they're giving packs in terms of their learning provision. If there's a further need for that learning when they come back, then we're happy to support the school like we are with the catch-up programme that we just talked about.
Another one for you, Senator Vallois. Are there any plans to upgrade the rundown toilets that aren't fit for purpose in some schools where hand washing facilities are to help prevent the spread of COVID? I'll be honest, that's the first I've heard of that. But toilets that aren't fit for purpose in schools, even more importance in this age of extreme hygiene.
Well, I didn't know particularly about the school toilets, but I'm happy to take that up with the facilities management team. Of course, we've got the budget, like I mentioned, in terms of the minor capital budgets, and we can take that up and look at how we can take that forward and fix those toilets. If the questioner wants to provide me with the direct case, then I'm happy to take that up.
I was going to say exactly that. There's no name attached, but if that person wants to get in touch with you, I suspect that would be useful if there is a specific example rather than arguing it's a broad brush issue. Andy says, this is one for the Health Minister, Deputy Renouf, will there be funding for additional health staff that are needed to bring waiting times down for tests and consultations? We can't ask staff to work harder. That almost implies this is somebody working inside the health service. We know we now have this live online data that you wanted so we can look at these waiting times, and some of those waiting times are eye-watering. The staff are working all the hours God sends and more, but they are also working in an increasingly unfit workplace that new staff certainly don't particularly want to come to work to. Thus, recruitment and retention is only getting more difficult and is likely to be the case for at least another 5 years. Will there be extra funding for extra staff to bring down waiting times?
Well, it's such a movable feast, that, Gary. The staff are constantly retiring and new staff coming in. We are always seeking to recruit. Recruitment is always open, and there's a lot of efforts that go into recruitment, and there are business plans that are coming forward all the time for new provisions in departments, which would include staffing. There's more than 2,000 staff across health and social services. There's a lot of people, and we're constantly trying to ensure that we get the best service in. So it's constantly.
I mean, I don't mean this rudely, but I always sound rude when I say this sort of stuff. I do apologise. That sounds like a non-answer. I mean, just in practical terms, if the MD of the hospital or if the Director General of Health and Social Care said, look, we need 10x, whatever that job is the answer basically, there's your budget, cut it up how you like? Or do you listen if they need more than they've got? I mean, at the end of the day, is the money? Is that the end of the story?
Because healthcare is constantly changing, there's always flexibility. And so I'm often getting requests for new staff. Well, certain levels of staff need to come to a minister and others for consent to recruit. And where the business case is put forward, that is never turned down as a result of funding pressures. So we find ways of getting in the consultants that we need, or the senior grades that we do need.
How bad is it?
Some services need to be much improved, and it's difficult to recruit to. Other services are providing excellent response times, and people get seen very, very quickly. it is mixed, I'm afraid.
No name on this, another one for you, Health Minister. Waiting lists for talking therapies. It's kind of making a point, but actually let's take the early part of the question as a question. Waiting lists for talking therapies is 12 months, yet the government's wasted over £50 million on 2 failed planning applications. How do you square it? So we'll leave that hanging as a rhetorical flourish, but actually the serious issue in that question about the waiting lists for talking therapies. I know we touched on the listening lounge, but in real terms, that's just not good enough, is it?
It's not good enough. We want those waiting lists to be better, to be reduced a long way. Again, it's a mixed picture. It depends on the level of need. At some levels, the waiting lists are certainly not as in that situation. At a more serious level of need, unfortunately, there is pressure on staff and numbers, as there is across the UK, across Western Europe, in recruiting the mental health staff that we need. But we are introducing local support for training mental health nurses. So we will grow our own, which is something new. We haven't done that before. And I pay tribute to Deputy Maçon, who's my Assistant Minister, who's been organising and pressing for that.
Are you making that attractive enough? I mean, I saw when that was announced. And again, it just seems obvious when you announce it. It's like we've got very talented people in this island who want to do a whole range of jobs, including working in health. And we have a hospital that needs people to work in it. Ergo, left hand meet right hand, get on with the job. Are we being ambitious enough? Are we making it attractive enough? Are we making it easy enough? Are we working hard enough to recruit and find those people? Are you speaking to the Education Minister and saying, by year 9, we really need to be tapping in and saying, have you considered a career in X, Y, and Z in health and social care?
That actually would you ask Deputy Maçon to answer that, because as my Assistant Minister, he was driving that. He was great at that. He can.
Yeah. So there are several issues. So as the Minister said, for healthcare specialisms across the world and Europe, there is a shortage of workers, and Jersey is affected by that, as is the UK, as is Europe. Now, because we know that, that's why we have developed the plans for the mental health nurses, and the reason why it's easier to keep people if you grow your own, because they're already here, they've already got the roots here, and it's much easier to retain them. There are other aspects which we need to look at, which is about the accommodation side of things, which of course does fall into the remit of housing, key worker accommodations, which has to be a priority.
However, if you're growing on island staff, the key worker accommodation is less of an issue.
Yeah, but you're always going to need a mix.
Yeah.
You're always going to need a mix. So there is all that work coming together in order to provide it. And what I would also add, and this is something which I did fight for in the government plan, which is exactly your point, is how do we get people into these things? The policy work around the retraining strategy so that people can transfer from one career into another, and how we support people to do that is something which I fought for in the government plan under the education section, because we need the policy in place and the funding to follow in order to allow people to do those types of things that you mentioned.
So are you doing it?
Well, it's part of the plan. It's something that we want to get on with, absolutely. And this is why I want to stay in education, because for me, that is a key piece of work that needs to be done. And Islanders have been crying out for ages for more to be done about supporting and training our own. Yeah. But how we do that when there are adults is something which is actually just left hanging, and we need to address it, which is what we're trying to do in the government plan.
Glad to hear it's in the plan. And actually, Housing Minister, I will stick with you with your housing hat on. Will you please put your names on these questions? There's too many anonymous here. Where's that question just disappeared to? Will you be looking for first-time buyers' places to be built? And with the cost of house prices, how do you think the next generations will be able to buy? I know you touched on it a little bit earlier when you were talking about, I will liaise with the planning minister, yada, yada, yada. We heard a little bit last night from the chief minister about flogging off some of the estate to free up brownfield sites and so on and so forth. Put some meat on the bones for us. What's going to happen, where and when?
So, as we know, there's already an estate review amongst the states in order to free up sites. Now we can, and then once that's done, we can then free them up for Andium, for SOJGC to develop, to build those units. We know the policy around SOJGC has been changing in order to ensure that there are more local buyers able to purchase those properties. But let's not kid ourselves. Yeah, it's a huge problem. It's a huge issue. I know many of the people my age, we know from the last elections, were saying, I'm a professional. I'm in a genuinely good job. but I can't afford to live here. So it's something which is absolutely wrapped up in the government plan, specifically the island plan, because again, the planning minister needs to deliver sites in order for us to develop, and those aren't going to be easy decisions. They're going to be some really tough ones coming through in the island plan. So we need to talk about increasing the supply of units. There is an interesting discussion which I want to have with the planning minister about land banking, so people who have sites who could be developed who don't seem to be doing anything with them. How can we tackle that one? And of course the other aspect, which of course everyone will be screaming about, is of course the population control, and how are we going to then not only tackle the supply side of it, but how do we tackle the demand side of it? And I will plug this already. So the Chief Minister has already lodged the mechanisms in order to address some of those controls which we don't have. So that, for me, that is welcomed in my role of Housing Minister. And then of course we need the overall population policy, which with all the services hinge on. So I don't know if that's directly addressed your question, but as you can see, it's not one simple issue. There's a lot of it's a spider's web, and you pull one bit and it affects all the other bits.
And I think that's the bit that makes me despair. You know, you guys, it's 2.5 years. You've been the government and the States Assembly, and you're making it sound like there's all this hard work that needs unpicking. Is it just that the last Assembly under Senator Ian Gorst was so appalling? Sorry, the last government under Senator Ian Gorst was just so appallingly bad, Chief Minister?
No, I don't think that's a fair comment, actually. I think the difficulty every government has had, some of it is about having the political will and having the political climate to grapple with the changes that you need to deal with. I think when we've looked about the underinvestment that's happened, in the past, I think there have been, I'll say individuals sometimes, not necessarily, but it then influences decisions who've not been politically brave enough to say, yes, actually we do need to spend this amount of money on X, on infrastructure. Boring as anything, isn't it?
And who is that? Are we talking individual ministers? Well, no, or are we talking directors general? Who is it?
No, I think it's about people who sometimes get swayed by what they perceive as popular opinion of that time without looking at what you're trying to get to about taking those. It's the longer term decisions, because as we keep saying, unfortunately, to rezone, to build on a green field, has to go through a process which is governed by law and takes ages. And so you need to start that early, which is why I'm keen on getting the brownfield sites out, because that's not going to solve my problem before the elections, but at least then they're in the pipeline and are released for after elections, and whoever is in power at that time will then say, right, the last lot left a decent foundation, as it were, and we've got that going. Now, some of that was happening from the previous government, because you can see the pipeline of stuff coming through, for example, Andy and others. But you had those other competing factors, financial crisis, don't forget, and that carried on for quite a long time. Yeah. Then you had the growth and recovery from it. That then impacted upon population, where they, unfortunately, for whatever reason, probably other priorities as well, it turned out you didn't have the control mechanisms in place to then limit your population, and obviously that's then added to the consequences we've got now. But they were also dealing with other fundamental issues they were trying to grapple with, including, don't forget, reform of the government system to try and get it to the point where we could actually deliver things.
So to summarise that, effectively, critics of you not being a man of action and certainly not doing anything in a rush, actually you're saying, do you know what, in 2, 4, 6 years from now you might thank me, because actually this Parliament has been about doing the spade work, getting the foundations in place.
Yeah, but I think also within all that lot, don't forget, and we're only X number of stages through, hospital project, the game plan is to be contractually committed before the elections.
Yeah, it won't happen. But
well, we'll see, but we've got the contractor in place and we've got the site agreed.
Yeah.
The next point is get the funding, and then it's the planning permission.
Yeah.
Funding is summer. So we're still on time on that. It's going to be tight, we've said that. We talked about offer strategy last night, which is the brownfield sites. I'm expecting that in terms of implementation, the final options to be coming me, as I said, before Christmas, the next 2 to 3 weeks.
Okay.
So that's about actually dealing things. Rich has got the Jersey Care model in place. We've just got 50 million quid for fiscal stimulus for next year. Don't forget, do not underestimate the impact of time of COVID. This year has completely taken so many resources out to what we want to do. So the normal business as usual stuff, a lot of this stuff we wanted to be doing in the summer, didn't we? And Brexit. So, you know...
Yeah, not much going on. No, I get it.
You haven't had a few challenges this year.
It is good to put all of this in
I think
perspective.
what you've got to remember as well is we've also seen under this Chief Minister a much more inclusive and...
Oh, don't start doing a love-in for
No,
the
but you
tells
asked
me
me,
when I'm wrong as well,
why have these policies not been pursued? It's because you've got different perspectives around that Council Minister's table, and it does make a difference.
Fine, get a room, you guys. Right, let's go to the studio audience. Normally this is where I look for a show of hands for anyone wanting a question. We have a studio audience of one whole human being. I told you we were COVID safe. We are easing our way in. Good evening, sir. Your name and your question and who it's directed to, if it's to someone in particular.
So I'm John Baker, and I've got my parish hat on today. I'm chairman of the Environment Committee for the new parish council, and I've got a question for both the Children's Minister and the Education Minister, and I'm hoping to get some synergy from them and some direct action. It's something St Helier has been asking for years and years, and please don't pass the buck to the Infrastructure Minister. That St Helier has been waiting for years and years to the answers to this question. So the question is, do they support the development of safe walking and cycling routes to and from all schools, and to reduce traffic and pollution around schools, and to promote the well-being of children? And if so, what resources are in the government plan to deliver this, and over what specific timescale, please?
Thank you very much, John. I appreciate it. I'll start off with the Children's Minister.
It would be better to start off with the Education Minister.
Go on then, I'll be guided by that. I wouldn't normally give in so easy. I will start with the Education Minister in that case. Senator Vallois, there we are. Safe walking to school routes, reduction in pollution and all that goes with it. A, is it in the plan? B, do you support the idea? C, what you're doing about it?
Okay, so just firstly, thank you, John, for your question. Yes, I support it. Yes, there is in the government plan. Unfortunately, I'm going to upset John slightly and refer to the Infrastructure Minister, because there is a safer routes to school under the Sustainable Transport Policy requirement. And you would have seen recently that a part of that is about the bikeability as well, encouraging more of our children onto bikes by doing what would have been known as the cycling proficiency with the help of Jersey Sport. So it's also getting our children and young people active. In terms of also having to work across departments with regards to trying to reach the 2030 carbon neutral strategy that was agreed by the states, we have to work together in order to identify that, and we work really well with the Environment Department around the eco-active requirements, walking buses to schools, and the various different parts. And I hope that has answered your question.
I mean, is this actually happening in any form at this stage? Do we have, sorry, and pardon my ignorance, do we have the walking buses in place? I saw a brilliant video from somewhere, I think it was in the UK, also of a cycling bus, and this is a convoy of school children cycling to school with teaching assistants sort of running as outriders. It was just a joy to see basically a mobile classroom getting together to go to school, and the traffic just has to stop and get out of the way and suck it up and get over themselves, because those kids were ruling the road, and it was wonderful. Are we doing any of this stuff?
Gary, yes, you'll see plenty that has been done. Actually, I think also one of the things that have come out of COVID as well, I know we can always talk about all the negative side of things, but we have to look at the opportunities that have come out of COVID as well. And one of them, you would have seen with regards to Lalonde School as an example, a large proportion of our children at that school getting on their bikes and going to school. That was really fantastic to see. We're seeing more of that happening because of the ability for the now more shared cycling proficiency offer, which is the bikeability with Jersey Sport. But the walking buses, they do happen. I think one of the issues that we have is whether there is the availability of people to support those types of walking buses. But all the different ideas that can come together around the safer route to schools transport policy, we work directly with the Infrastructure Minister, with the Environment Minister, and of course with the Health Minister with regards to making sure preventative health as well.
And I think that's an important point as to how these issues don't sit in silos, but I also don't want to use that as an excuse for any of you to bat away these questions. So, Children's Minister, right back at to you. As a principal, well, I'd be gobsmacked if you don't support the principle of this. And this isn't just around schools and education. This is around whole lifestyles as well, whether it's going to the new Edge of St Helier Youth Club or the Move On Cafe or whatever else is being provided in this government plan. What are you doing about it? What influence can you exert? And actually, what concrete measures can be delivered in this plan to achieve the aim that John was talking about?
Sure. So, and that's why I didn't want to step on Senator Vallois' toes, because we know that actually it's already policy in the education department to support safer routes to school. That's why I wanted her to answer first, not
Sure.
to step on her toes. As for what I can do as children's minister, obviously my role under children's services is much more limited in what can be done there. But of course, I'm more than happy to support my colleagues in health and in education in order to drive that policy forward. Yeah, absolutely.
And, taking on this brief, there has been some coded criticism of what level engagement there's been between government and the Children's Commissioner, for example, on some very basic announcements. I remember when the Chief Minister was doing putting the willies up everyone, all kids have caused the death of the island from having a party and Halloween press conference that you then did at, I think, at 1 or 2 o'clock in the afternoon, blaming kids when they're all at school. It just looked tone deaf and dumb for not having consulted with the Children's Minister on the best way to make those announcements that engage. I just wonder, as Children's Minister, will we notice a difference on your watch on this stuff?
It's interesting. I've had some policies I've had 3 working days. I've had some policies I've already said, yes, let's run this past the Children's Commissioner first. We do have to remember, though, she is independent.
Yeah.
So whilst we do take advantage of her, there are some times where she can't always be, on both sides of the fence. There are some times where it is appropriate for her to see something in its form and then comment back to us. But I absolutely value that, we've created that position in order to better refine policies and communications, etc. So yes, if we can take advantage of her offer, yes, we'll use it. But we must remember she is independent.
And Chief Minister, I've got to give you a right to
You've
reply
definitely got to give your right
oh,
to
no,
reply
and
on
I was
that
going
one.
to anyway. But I stand by the point
Yeah.
I make, is that regardless of what her role is, you have got an external resource there. You can just pick up the phone, for goodness sake, on your way to the press conference and go, do you know what? We're just about to announce blaming kids for having a bit of fun for causing a spike in coronavirus. And she'd probably go, that's a bit stupid, Chief Minister.
Well,
Have
it's
a hoot."
interesting because
you didn't do that.
You get different opinions. So I had
Yeah.
I had 2 emails that came in. One, I think, almost literally in 5 minutes, and one was along the lines you've just outlined, outraged, all the rest of it, and grandparents, and the other one was saying, very good, very firm line. And thank you very much.
And the firm line one was from a 12-year-old child?
No, these were both from adults.
Yeah, no,
okay.
I'm making my point.
Now the point I will make is that again, and it was already in our minds, by the way, before the thing was raised, and I think it's actually starting this week, was actually how do we get the message in a different way into the schools.
Yeah.
And so there is a piece that's been put together. I believe it's either scheduled to start this week or next week, and it is about very much how do we communicate directly to them. But the point that we were also making at that time, and some of these things do come through at quite short notice in terms of you've got to get the message out. It wasn't about stigmatising, but it was actually being just actually factual that during that half-term week and around Halloween, where one of the sources of infection was coming from was from parties.
Oh,
and the
I
youngsters.
get that.
And
I get
that was the point. So
I get the
we had
facts
to
of the
get that message
announcement.
out.
It was,
and to an extent, that message has been at least understood, even if it wasn't appreciated.
I think
Yeah.
it was more the clumsiness of the announcement that perhaps with a bit of hindsight, it could have been delivered in school assemblies on the same day. That could have been a quick phone call to every head teacher to say, do you know what? I'm just going to record this 5-minute video on my mobile phone. The kids don't normally see the Chief Minister appearing, so
Yeah.
it'll be a bit unusual. And here I am. Guys, just to let you know, 2 o'clock this afternoon, I'm going to do this press conference where I'm talking about these Halloween parties. I know you didn't do it maliciously, but actually there's a really serious message here. You look a bit more human, you show a bit of empathy, and you don't cause as much anxiety as you evidently caused.
Well, according to some people, we
Yeah,
did. and
according to the people who were
and
made
according
anxious.
to other people.
Yeah,
we
but the people
didn't.
who weren't made anxious, and those who were.
Well, this is the problem. But it comes back to this point. So yes, and we move on. All the rest of it. You've also got to remember on all of these. Sometimes it's literally a matter of time.
Yeah.
But the other point is that, we know we've got to. We've said actually, and as we were dealing with that previously, we are playing catch up slightly. And the other point on the COVID side is it moves quickly, and sometimes you don't have the chance to do that.
Fair enough.
But the message did go out, and hopefully some people are taking it to heart. We'll see.
Okay. John, bear with me 1 second. I will come back onto that. Thank you, sir. The whole studio audience just spoke to me. It is 8 o'clock. You are watching the Government Plan Virtual Public Meeting, night number 2. We're focusing on investing in our future. Joining me on the panel tonight is the Chief Minister, who you've just heard from, also the Children and Housing Minister, the Health Minister, and remotely joining us on the big screen is the Education Minister, and it's John in the audience as well. Just want to go through a few more questions, and then, John, I will come back to you to give you another go as well. Sasha, this is for the Health Minister. Can the Health Minister confirm when a Parkinson's doctor and or nurse is going to be appointed, considering we've not had a dedicated resource for a few years? Is that in the Island Plan, Minister? In the Government Plan, Minister.
Well, I don't know specifically about Parkinson's, but we are working with the voluntary sector and so many other people, our memory clinic, about delivering a dementia strategy, which we recognise is absolutely needed.
But dementia is not Parkinson's. The question is about Parkinson's.
Oh, you're right. I'm sorry. It's been a long day.
That's all right.
So I don't know of that detail. No, I'm not aware. But that I can make inquiries about.
Okay. Well, if Sasha wants to make contact with you, would you be able to follow that up for her?
Yes, I'm very happy to do that.
Another one here with no name attached. There have been rumours, and I've heard this as well, of the assisted reproduction department, the fertility clinic, of it being shut. Is that a plan?
No, that's absolutely not a plan, and those rumours are false. We want to enhance that service and not cease it at all.
No name on this again. Why do you not utilise the properties owned in Kensington Place for nursing accommodation? Also refurbish the old nurses' accommodation. Now, no, there's been quite a body of work been going on with key worker accommodation, but properties already owned in Kensington Place, Health Minister, is that something you've looked at? Is that correct? Is that doable?
The properties owned in Kensington Place are presently being used, I think, by our drug and alcohol service. But they're old properties. I really wouldn't like to house nurses in there. We've got an excellent offering now of key worker accommodation in modern refurbished units that I've looked in, that I've walked around, and they're a lovely home to live in, and they are flats there for single occupancy and family occupancy. And I have no hesitation in encouraging the people we need to bring to the island and saying you're going to have a good home in those.
And I think that's a key part of the message, isn't
Yeah.
it? So to be able to have that, to get people through the border in the first place, effectively. Education Minister, again, no name on this. Will the government invest in University College Jersey to meet skills shortages discussed? And I had a separate one, and sorry, I can't find it in the list here somewhere. Oh, there it is. Is there a plan to update the poor state of buildings and facilities at Highlands College? I don't know if they're necessarily one and the same, but in terms of University College Jersey and Highlands, what are the plans, Minister?
Yeah, Gary, they're the same thing.
Okay.
University College Jersey and Highlands College are the same campus. That particular campus, yes, it needs investing in, seriously needs investing in. So there was a plan to do the feasibility this year. Of course, COVID came around and knocked that on the head because many of our officers had to go away and deal with the COVID situation that we had. It's back on the agenda, it's back on the plans to look at how we can manoeuvre that Highlands campus into an appropriate centre for offering equal academic and vocational offering, which I think is really, really important because some of the issues that we're seeing, for example, you can only do A-levels at Holier, and being able to do A-level with a vocational course is something that's seen around the world and has helped many, many students to go on and reach their aspirations. And a suitable campus, of course, fits with that.
And how much work needs doing that? I mean, I'll be honest, I don't go to Highlands very often, but when I do, I mean, it's a mishmash, hodgepodge of stuff. Some looks bearable, some looks embarrassing. Where do you even begin with that? Is it a case of continuing to patch up, or can you throw a huge amount of money and go, knock the whole damn thing down and start again and do it properly?
Well, Gary, as you'll know, we have this requirement with regards to listed buildings and historic requirements. Some of our buildings sit within that. Of course, the campus largely is covered from what is an old school, some porter cabins, and the main building, of course, we know as the Turner building and where the reception area is. A variety, and they do a fantastic job, by the way. They do a really, really good job within the building that they have. I'm sure the Chief Minister would maybe like to explain the whole estates strategy side of things and why that's important, because actually I think this falls into one of the issues we've got across our wider portfolio of our estate, is that what's happened is it kind of is just evolved as it is over time, because that's what we've had to do with. And I don't think we're in that space anymore, because if we want a really good future economy, we need to have the appropriate environment to provide those skills in. Doesn't necessarily mean you need a huge campus for that, but we need the flexibility and the opportunity and the choices for our students so that they can reach their aspirations.
And I will come to the Chief Minister in just a moment. I'm just going to get through a few quick-fire questions that I'm spotting aimed in your direction, Senator Vallois, while I've got them here. Jackie asks, what work, if any, has been carried out to extend Rouge-Brion School into the former police headquarters site, please? I know we've heard that time and time again, haven't we, that, what could that site be used for? Can the school spill over into it? Could it be used for X, Y, and Z? What's actually happening, if anything, on that front?
Well, as you would have heard, it's now temporarily housing, will be temporarily housing the Sea Cadets. The Home Affairs Minister announced that in the last couple of weeks, I believe. Yeah. The work that we want to look at, and you would have heard the former Children's Minister talk about wanting to use that site for Rouge-Brion School. I would particularly like to look at us utilising that, but I think it comes with looking at our whole primary school estate in St Helier and making sure we are actually offering the best, because some of these schools don't have the right outdoor space. And of course, we need to recognise our responsibilities as corporate parents, not just as corporate parents, but our responsibilities under the UNCRC, and ensure that we're giving them the best offering and the best start in life. And I don't think the availability of the property that we have in that space at the moment is sufficient for the number of children and the needs that we have in that school.
Just to be really clear, and I don't think you were saying this, but you're not saying the fact that Len Norman's sticking the Sea Cadets in there for a little bit because he's trying to sort them out something more permanent, probably something somewhere near water, ideally, that will get in the way of Rouge-Brion School moving into that site if you think it's warranted?
No, I don't think that will be the case at all. Like I say, that's why I emphasise the temporary requirement for them to be there. There is work that will go on with looking at what we can do. We have to recognise, of course, we also have the fire service on that area. So if we were to move the fire service, where would we put that? So it's like it's like one of those dot to dots, and this kind of fits within the whole wider estates situation that we have. So if we were to extend and create the appropriate environment for Rouge-Brion School, what would that look like? And therefore, what would that mean for the fire service, and where would that go? Now, we've seen the problems we've had with regards to the hospital and how long that's taken. We saw the many years that it took for us to build the police station as well. Do we want to be in the position of not having a home for our fire service? So we need to make sure it's joined up.
Chief Minister, I mean, I've got a question that I'll hang these follow-ups on here. Yeah. It says, why did the state spend £11 million refurbing Cyril Lamarcon House, only to close it and move and pay for an office in Broad Street? Fiscal suicide. Well, I'm not sure. I'll leave you to characterise this as that. Perhaps fiscal imprudence. It's a big issue. It also feels like, you do one thing, it knocks on something else. However, the risk is, because of that, you end up just doing nothing. That's
always a problem. And what I've learned with property is that people love to hang on to it within departments, and the number of times I've seen not quite a room this size, but perhaps a room, I don't know, a third of this size, which obviously the public can't see, with one person in it, which in these days is just ridiculous, because the theory behind that, it all costs money to heat or clean or light or whatever it is. And also then that goes into this whole thing about culture of the organisation, about silos, you name it. And the reason we split between what's called an office strategy and an estate strategy, an estate is literally what it says across the whole portfolio. We've heard about fire stations, we've heard about police stations.
So what's the office bit? Is that civil servants at desks?
Almost.
Okay.
But what it is that it's where people are doing effectively administration,
Right,
if you
okay.
like, office work. There are an awful lot of properties, and I'll use, let's say, the old St Saviour's Hospital. I've been in. I first went in there, I think, in about 2007, and at that point, so it may have changed, okay, but at that point, 2/3 of the building was empty. Some of it was used for storage, and some of it was used for manual handling, and there were a few offices in there, and the offices were spacious because it's a very, very old building. It's lovely. But you think about the what that site is worth in terms of housing, what it's costing to run, all those type of things. But you've got to then, your first point is, there's obviously mental health services up there, for example, as we know, and you've got to have that facility to deal with it before you can free up that site effectively. So you can't suddenly jump in and clear it.
Can you not?
Well, you've got to find somewhere for the patients to go, is what I'm saying. And that's where, for example, hopefully Hospital Overdale Mental Health Facilities then does free up. But you can, once you now got that decision, you can now then hopefully be starting to plan, this is what we're going to do with St Saviour's Hospital. So that actually you don't then spend another 5 years after it. That should be the estate strategy. The office strategy, as we've said, and I'll say it again, is about saving money, ultimately. It's about freeing up brownfield sites. It's about clearing up the silo mentality. And actually, in all of this, is actually looking at what do you do and what's our impact, for example, in areas like St Helier, and can we bring a regeneration aspect to that? That's about, do the services you provide generate more footfall? Does that generate more business into the high street? That type of thing, which is that kind of slightly difficult to quantify, but that should also influence your thinking, in my view, as to how we deal with things.
Cyril Lamarcon House, affordable housing, a Cooper's Coffee downstairs, a little co-op locale, and a shared community space that could be used by community groups for different clubs. Maybe the youth service do a drop in there. Why has that not happened?
Well, you could almost go for it. So so I'm not sure about where the 11 million came from, by the way, because that's definitely before my time.
Let's not worry about that.
Yeah, exactly. Cyril Lamarcon, old building. In terms of the modern standards for office space and things like that, and proper utilisation, doesn't work. The state of the lifts, for example, was horrific.
Yeah.
All those type of things. So it was getting to the point it either needed a lot of money spent on it, or you moved on. In terms of housing, as reason, it's taken quite a while to get out of there, because things like the servers and things like that, there was a lot of computer equipment there, even when people weren't there.
Yeah, it had to stay, because if you unplugged it, we'd be stuffed.
Exactly, and then you have to
you
have to migrate that across. So I think we're at the point now. As I said, where I'm expecting South Hill to be coming forward shortly, in terms of, because that's the site that's been cleared out. Cyril Lamarcon should be coming along fairly soon afterwards.
What does fairly soon mean?
During the course of next year.
Okay.
And that's so there have been plans looked at. Sometimes you get into these discussions, so is there a site next door which allows you to bring make it bigger?
Yeah.
So you have those discussions. That can sometimes take time. The one thing I've learnt with property is that, as I said, people like to hang on to it.
Yeah.
Or alternatively, they want to get rid of it. They want to charge you for it, type of thing. No, those two sites, once we get office strategy agreed, as I said, hopefully in the next few weeks, and I mean literally, I'm expecting it before Christmas, that then says a go, no go on certain other issues that happen, for example, on Cyril Lamarcon. So there is a bit of a jigsaw, but we are starting to get a degree of momentum. I'm always cautious here, because I've been waiting for this for 10 years.
But you are the Chief Minister.
Yes, but 10 years ago I wasn't.
No, that's what I'm saying. You are now the Chief Minister, so let's cut through the crap and get stuff done.
The fact that we've taken about 18 months to get to where we are, I'm really pleased with. But before I can say, yes, we're there, I need to get through the next 6-8 weeks.
So next year we could see work on affordable housing in Cyril Lamarcon House with a Cooper's Coffee, a co-op locale, and a community space downstairs.
I'm not designing it, but I would expect
something like that.
For me, I think that would be a perfect use for Cyril Lamarcon.
Great. Okay, call it Gary Burgess House. You can have that one on me. Right, let's go back to our audience. Is there anyone in the audience? John, you're back. Another question, please, sir.
Well, I haven't got another question. I want to give a response to my previous question, which I'll remind the audience was about safe cycling and walking routes. So I got lots of fluffy answers there, and I got the silo mentality back because it got passed on to the infrastructure minister, and no firm promises. I just would make a commitment, representing St Helier, because I'm on the council, I'm on the roads committee, and we need to work together. The roads committee is responsible for the minor roads in St Helier. The infrastructure minister is only responsible for the main roads. So we need to cut down the silos and work together. So here's a little project that maybe you guys can take on. How about setting up exclusion zones 200 yards around these schools? It's happening all over the world. It's certainly happening in the UK. Parents should not be able to drop off their kids, directly outside the school. They're in the habit of jumping out at the house into the Range Rover, drive to school 10 or 15 minutes away and dumping the kids off. They could just as easily, and probably just as fast, walk or cycle or bus to school. So how about some exclusion zones around these schools?
Thank you very much, John. I'm going to leave that hanging as an observation in response to your answers. So I do appreciate it. I'm going to try and get through a few more questions. We've got just another 15 minutes. Thank you so much for all of these. And a reminder, we're doing it again tomorrow, Thursday and Friday as well. This one from Sarah, Chief Minister. Given the loss of a Minister for Mental Health, when will that post be filled? For me, the obvious person is Deputy Pamplin, given his support for mental health. I'd already heard on the jungle drums that your new Assistant Economic Development Minister was going to be Kirsten Morell, and that your new Assistant Minister that would do mental health would be Kevin Pamplin. Do you want to confirm those now?
I'm not talking names.
No, I am. I'm just wondering
I
if
know
you
you
want to
are.
confirm
I'm
that
not talking names, but I'm hoping we'll get that sorted during the course of this week.
Okay, let me ask the question in a different way. Do you think Deputy Kevin Pamplin, given his passion for mental health, would be a good addition
I'm
to
still
your
not
team?
talking names, and hopefully I'll get that position sorted out during the course of this week.
Okay, fair enough. Is it important to actually have that carved out as a subset within health in your mind as Chief
In my
Minister?
mind, absolutely.
I know that sits with
Yeah.
the Health Minister. I will come to you, Deputy Renouf. But from your perspective, that subset of health does have a champion.
When I put having got the ministers in place back in 2018 and then worked out through the assistant ministers, as Jeremy will know, the idea was that we had certain same person fitting under a couple of ministers to ensure cohesion across. And so that was both Jeremy and Steve Hallett did bits on mental health. And so essentially, from my perspective, I'd like to see someone under Richard for, I'll call it adult mental health, and under Jeremy for CAMS. And that same person to make sure there's a coordination.
And Deputy Renouf, I guess Deputy Pamplin would be the obvious choice.
We're still talking, Gary. We can't mention any names yet. That'll come around in the fullness of time.
Fair enough. Right, that's myself. Let's go back to the Education Minister. I can't pick out any one particular question, but a few have referenced free school meals. I know there's a little trial going on, but I also know caring cooks are ready and have the resources to literally tomorrow roll out every year, every school dinners provision. They have the resources, so don't give in the logistics game of we need to bolt a kitchen onto every school because it's tosh. Education Minister, can we have free school meals? Are they in the government plan?
Gary, the pilot is still ongoing, and the problem that we've had, of course, is with COVID. It's struck out some of that data and information. We are extending to St Luke's in January under the pilot. That funding is in the government plan as agreed. In terms of the requirement for facilities to provide the hot meal service, it's not in every school, and we will be working, because this is again a cross departmental agreement. It comes under the food and nutrition strategy, which sits under health and was being worked on beforehand. The point in doing the pilot is to identify the demands, the need, the requirements, and recognising that the support and the funding through, maybe whether that's the Jersey premium funding or whether that's parents offering that particular payment for that, then we could look from looking at that data and that information and determine how we fund the remaining, so the beginning of the term for 2021. And then, of course, we'll be going through this process all over again next year about school meals in the government plan for 22.
As a principle, for those who can't afford a meal for the school to provide a free school meal, do you support the principle?
Yes, I do, and I've spoken about it when I was stood for election, when I stood as senator. I supported the health team who were in charge of bringing forward the food and nutrition strategy, who specifically referred to the offering and doing this pilot in order to identify whether we need to spread it out right across our schools.
One more for you. Again, I appreciate this will straddle a couple of departments. Surely if you want to support children with their mental health, giving funding for a full-time member of staff in primary schools would be a start. A mental health expert in primary schools, Minister?
Yes, so we've got a number of offerings in terms of our inclusion process. Now, we're just about to embark on an inclusion review, which is looking at all special educational needs and particular behavioural needs and all of those areas, because the important part of is actually identifying inclusion in mainstream schools and ensuring we're providing the relevant resources at the right time. Some of these children need either one-to-one or two-to-one support with their particular needs. So when we talk about the resources in the schools and the needs, and this goes back to this preventative health support, what we have in our school, most of our primary schools, we have emotional literacy support assistants who assist children at that very early stage where they're experiencing some form of anxiety, potentially could move into a particular mental health issue. But this goes back to this universal and universal plus kind of offering, which our schools are really, really good at, but we need to make sure we've got the people in place. So where that will help is our Jersey premium funding. It will also help once we've completed our inclusion review that looks right across the board, and working, of course, with the new Children Housing Minister and the Health Minister around the more targeted needs in terms of our mental health. We want to look at basically turning some of these issues completely on their head and ensure that we're getting in preventatively rather than allowing it to reach the point in which it's just extremely difficult to come out of that problem that those people are finding themselves in.
One for the Housing Minister here. With private rental prices for 3 and 4 bedroom houses at an extortionate level, and we were looking at the sale prices report that came out of Statistics Jersey last week. I mean, it is ridiculous. But on the rental level, how are families who are claiming income support meant to afford such rents? What do you say as Housing Minister to people who they can't even aspire to get into that property? It's just not realistic.
Yeah, absolutely. And we all know it's an incredibly difficult aspect. I mean, I'm not going to shy away from that particular issue. We do know that the Housing Policy Development Board have produced their report, and it's due to be published imminently. I know within that report there are several recommendations for myself as Housing Minister and for the Planning Minister to start looking at these types of issues. What I would also say is, of course, what we should also be looking at is something along the lines of the European-style rent control aspects. We had an in-committee debate in the States Assembly, informed by the Jersey Policy Forum. I can't remember their exact name, but they're an independent group that produced a paper, and that seemed to be getting support from members within the Assembly. So it's certainly something on my to-do list.
So you're talking about rent controls in the private sector is something you plan to explore, not necessarily commit to, but it is something you are willing to look at.
Yeah, absolutely. And there is money in the government plan in order to support the Housing Minister to develop policy in these areas.
With your Children's Minister hat on, you will now be chair of the Corporate Parenting Board. It embodies putting children first and will be the political drive for children to have good childhoods. How will you lead and drive on this is the question.
Well, again, it's looking at those particular outcomes to do with children. In particular, I have a passion, being dyslexic and dyspraxic myself. I'm very keen to see what the inclusion review will churn out, because I think we do need to do a lot of more support for particularly those children in those areas. But of course, the Corporate Parenting Board is also about kind of the culture of departments, how children and young people, how they interact within the department. So those are the types of issues which I want to promote. It's about culture and also about for those with special educational need.
Health Minister, one from Neville here, who says, and by the way, I've not seen the report, so I don't know this to be correct. They say the JEP are saying indoor face coverings are now the law. I suspect it's more nuanced than that. They're now saying there is a law that allows them to be mandatory. Neville says, is that true? What effect will this have on public-facing business tomorrow morning? I already know the answer to this, but I think, even though we covered it earlier, let's be really clear. Let's start off with where we are this second when it comes to the wearing of face masks. So right now, what is the rule?
So today the states have passed the law which allows me to make an order which would make that mandatory. But the order has not yet been made. It'll be drafted over the next few days. And I hope next week face masks will be mandatory in shops, supermarkets, those sort of venues.
So just again, to be really clear for Neville and anybody else watching, right now, it's strongly recommended.
Strongly recommended still. And I would really urge people to wear that mask, because don't we want to protect our friends, our family, our neighbours? It does offer a degree of protection. It's not a panacea, it's not the answer to everything, but with all the other measures we are putting in place, it does help restrict the spread of COVID.
Have you noticed an uptake in the wearing of masks?
I think there has been over the last couple of weeks. You do see more, but having that law in place just is an encouragement to people, and it's got to be more than an encouragement. It becomes a legal requirement, but it just means that we all do it for the sake of helping each other.
And when you do make that announcement, I've had a number of people, particularly in the hospitality trade, a bit grumbly about the latest changes, that there was no end date put on them. When next week you make masks mandatory, goodness, that was a lot of alliteration for this time of night, will you say that is until the end of January, or will you say until further notice?
The law that was passed today only has effect until the 30th of April next year.
Yeah.
It can come to an end sooner than that, but all our COVID legislation is until that date.
But your orders can be whatever you want them to be.
Yes, but they couldn't extend beyond the 30th of April.
No, that's what I'm saying. Could it be the 30th of January, for example? Or would your plan to be just I announce it and it stays on the books until I unannounce it?
Yes, so it wouldn't be the way we draft orders to say it's to the 30th of January, because it might end before that.
Sure.
Well, I'm required to only have that order in place where it is necessary and proportionate to do so for the protection of islanders.
Another one for you here, anonymous. Tomorrow night, put your name on these. Just make up a name, make up an amusing one and try and catch me out. Can the Health Minister expand on plans to move A&E minors to outpatients over the winter? How will this be staffed and where will outpatients go?
So I think outpatients are staying where outpatients are.
To move A&E minors to outpatients.
Yes. So I think this is just a logistical move within the hospital. Staff have determined that A&E minors, which are now at the parade end, can be moved to the Newgate Street end, and it will operate from there together with outpatients side by side.
So just to unpack that in simple speak, if it's something that is not dead serious,
yes,
we go through the back door. If my leg's falling off, we go through the A&E front door.
Yeah,
is that what we're moving to?
Yes, I suppose so. This is operational. It hasn't needed to come up to me for deep analysis. This is just the A&E department working out how best it can work. They need space for this serious element of A&E.
Okay, we will keep an eye on that. Right, we're down to our final couple of minutes. We are nearly wrapping up. Time absolutely flies by, but I know you probably want to watch I'm a Celebrity in half an hour. Let's just do a quick final round robin and questions that we can carry over to tomorrow night and the night after. I promise we will, because some of these are not necessarily directly relevant to the ministers we have here, but just let's wrap up with some Jerry Springer final thoughts. Well, Jeremy Maçon final thoughts. Children's and Housing Minister, if we were to take away one big hope from this 204 pages from the stuff that's within your domain that will actually get done by the end of next year, what should it be?
So I think it is the change to the CAM service. I think the priority that has been given for the early intervention work that's going to be done within the department, I think that is something which is going to be something I'm definitely going to be pushing for.
Health Minister?
Continuing to drive to improve our mental health services.
Okay, so we're spotting common ground
Yeah.
on this. It shows how much of an important issue it is for the pair of you. Education Minister, I mean, there's not much going on in your world right now. What's top of the pile for 2021? And yes, I did have my tongue in my cheek when I asked you that.
Yes, I heard the tone, Gary, but thank you. In more seriousness, the beginning with regards to the education reform programme is a really, really important foundation for the next 10 to 20 years for education. So we'll have a new funding formula, we'll have more funding for English as additional language, we'll have more funding for Jersey Premium, which means more children will get the extra support, like the questioner asked earlier, with regards to, especially our emotional literacy support assistance or that preventative health requirement, working directly with Deputy Maçon and, of course, Deputy Renouf's departments to bring together that commitment to that preventative health. So that's the key for next year, and ultimately getting to the point of having a new piece of education legislation too.
And what about you, Chief Minister? I'm guessing it's trying to work out how the heck's paid for all this.
I think it's a combination, yeah, ultimately. So what we've just heard is about the improvement of services to islanders. So, yeah, education, mental health and health, just to name but two. But everything else that's in the plan that we've identified and that we were building on from last year. For me, then, a lot of the infrastructure stuff. So, again, keep pushing forward on the hospital. Yes, I keep going about officers. I want to see some progress on Fort Regent. And on that one, I've split it into two. I wanted a short-term thing, which was to get Snow Hill entrance sorted. Again, hopefully very close on that. And then the longer-term thing of what is the future plans, which again is all coming together. And then finally is making sure we can pay for it. And don't forget, COVID and Brexit are the uncertainties that we're dealing with, all that lot. We have a plan. It's the best one we can put together in an area and a time of probably the biggest uncertainty we've had since the Second World War. But it is a plan. It does work. And there's flexibility in it as well.
And it leads us nicely on to tomorrow night as well, when we're going to be focusing on generating economic recovery on the third night of our virtual public meetings. I want to thank our ministers tonight: Chief Minister, Children and Housing Minister, Health Minister, Education Minister, everyone in the studio audience. I can name check John, bravo. If you want to join us in the audience, then you can drop an email to govplan2021@gov.je. I think I've got that right. If you want to be in the audience tomorrow, Thursday or Friday. I'm going to play a bit of tag team with Carl Walker. So Carl Walker will be in this seat tomorrow night. I'll be lazing at home watching and posting questions with amusing made-up names. You can be sure of that. I'll be back Thursday. Carl will do it Friday as well. It's from 7 till 8:30 on all the government socials, and catch up anytime you like. Joining us tomorrow night, Isa Glisson for punishment. Chief Minister returns. Deputy Chief Minister is Senator Lyndon Farnham. Minister for External Relations, that's Senator Ian Gorst, and Minister for Social Security, that is Deputy Judy Martin. So all of that, 7 o'clock tomorrow night. Thank you for watching. See you soon.